I have one more to admit. Good morning. I am Professor Jennifer Harrison-Hauer, and this is week 2 of your community health nursing. Just a few things to cover today. Let me admit some folks in. Where to start? Exam 3 next week. No, sorry, back it up, Jen. Exam 1 next week will be in class. That will be our entire class. Again, whether you're done in 30 minutes or the entire class period, that is our class. To let you know in advance, so you can please, you can always email me. Please try not to email me, especially if I say, I will not have your grades available until I have your grades available. There's this analysis that's done, it's a thing. We aim, because Friday is the last class of the community health week. And so we started off at 9, and then there's a couple of 6 p.m. classes. So that's Friday night, and then there's Saturday, and then blah, blah, blah. So if you say, did I, please don't. I will give you your grades when I have them available to me. Also, I have my exam 1 review today. There's live sessions, and I know you guys have clinicals, and I did get an email. We do like to post other professors, everyone else's reviews, and as soon as they get them to me, and I got like 2 yesterday, and I sent them out to you guys. I checked my email. So I'm in clinic Monday through Thursday. So usually when I check them when I get home, I'm like, oh, all right, I got 2. Let me give them to you. My exam is 9 p.m. your time, which is 6 p.m. my time. Okay. And then you guys did really great with your first paper. Just remember, you want to follow just follow the rubric. Like if you follow the rubric and make sure, like so when you title the page, it's Professor Harrison-Hauer, not Professor Harrison. I'm just a stickler about certain things, like my name. Just copy and paste my name, people. It's not Hauer, it's not Harrison. Well, it was a Harris, and it's definitely not Jennifer for you guys. But it is Professor Harrison-Hauer, so please put that. That's part of your grammar. Please make sure, did everyone, no one's gonna not admit to it. You have you have your groups, and these are the groups you'll stay with for all of your group stuff. Make sure you reach out to your groups in a timely fashion. I know this is gonna be an awesome class, and I won't get emails from people. I haven't heard from, I'll just pick on Jocelyn, or I haven't heard from Tika, or Letitia hasn't contacted me, and blah, 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 blah. You guys, I purposely mixed you up so that you have a chance to interact across campuses. So you guys reach out to each other. It is 1 grade. So yeah, so that's that. Okay, well, let's get into it. So before I get started, just to let you guys know, we do have the case study. I just gave you a blurb of it. I'm going to put you guys into breakout groups. You'll be in there for a bit. You'll work through the case study. We'll come back through and we'll nail it, go through it together. It's my favorite, one of my favorites. I have several case studies because it's a really good intro into population health, public health, community health. You'll hear those terms interchangeably. So it's a scenario of a nurse going through a group of people and what to do with this population that she has. All right, so let's get started. This is going to be, okay, Megan, got you. This is going to be interactive. I just want to review a few things. I got my notes here. So Sarah, when well, if I say, what is population health, public health, what's the first thing that jumps out to you? I'm gonna call on people, it's interactive.
When I hear
Don't hurt yourself.
population,
Come again.
is that what you said? When I hear the word population, what comes to mind?
Public health, what jumps out? What do you think about?
Vaccinations. That's the
Okay.
first thing I
Okay,
think about.
Katie,
I just think as like
what is public health?
or higher income, depending on their insurances.
Say one more time.
I said I think of it as like some people come from a lower population or a higher population, and of like their insurances and where they're from.
Budala, what do you think about when you think of public health? Good answer, Katie. I'll take anything at this point.
Okay, I think it's the
And I need to be able to completely see, I'm sorry, Budala, your faces. Like, there you go. Ashley, I know it's early, but it's earlier for me. Can't see your faces. I want to see your beautiful face. If I have to get out of bed at 5:30 my time, I need to see bright-eyed and bushy-tailed. Go ahead, Budala.
I think
Sorry
it's
about that.
the general well-being of everybody, the community.
That's what so when you, very good, very good. So when you think of public health, you're thinking of, don't think of this totally opposite mindset of bedside, because your community is your one unit that you're focusing on. So everybody that's in this bubble. So when you define your community, you're like, okay, what did I, simply put, what can I do to help them live the best possible life within the resources I have, within all of this other stuff, you know? And in order to do that, you have to know what you're coming up against. Manisha, correct me if I don't get your names right, because I've not
Manisha.
said them. Say it again.
Manisha.
Manisha, talk to me. How would you assess your community? I'm gonna ask several people. Give me one thing that you can do. You don't know nothing about these folks.
Okay. Would it be like through surveys?
You could tell, yeah. Okay, and then give me Megan.
Which one?
Oh, Lord, all right, Brumbaugh. How would you find out about some folks?
Megan is not in here right now. She's trying to get her computer reconnect.
Oh, she came in, I just logged her in. Okay, give me the other Megan then, delay.
That's me. What was the question? Just how do we assess the
How would you, if you
population?
didn't know anything about this community, your defined community, how would you get to know them? Surveys was mentioned, that's good. How would you get to know somebody you don't know? You want to get to know
Public health fairs.
Okay, I will take anything right this moment. Deepa? Y'all did not read your chapters.
I was gonna say community fair as well.
My
Like-
heart is getting broken on multiple levels. Tika,
Like community survey.
okay, let me put you guys out of your misery. So your textbook says, and then I added my notes, you want to somehow collect data on your population. It doesn't really, you can collect data about the census. How many people are there? Who's there? How many are black, white, purple, orange, green? You want to monitor their health status, and then you want to make that information available. So when you assess your patient, when you do a community assessment, that's your head to toe of your community. Just think of it like that. That is your head to toe. You don't know nothing when you walk in that patient's room. By the time you assess them, I hope you know something. So then public health, population health, it's population focused. So then this entire semester, you got to get out of the mindset of clinical, really, and more health promotion, disease prevention. Poor Megan. Megan's blessed. Megan, are you with us, dear? Are you with us now? No. Okay, rolling on. So when you think of a population, a population could be your population of homeless people behind the Circle K. I mean, so you define it, however, whoever you work with defines it. But it's a collection of individuals who share one or more interchangeable things in common, personal and environmental characteristics. So for me, it would be my folks on the reservation. Just think of, what is it, Mockingjay, District 1, District 11. So we have villages, and so that's my population because they live in that village and they have that major thing in common. So anything I do with that community and that village on that remote reservation affects that community, hopefully for the better. So that's just some things, the key points I'm trying to drive home with you guys to get your mindset into community health, population health. Is think of it as the good of not one, but of many. What can you do for the good of one thing that you can do, an intervention that everybody will benefit from? You're fair when you're giving out flu shots to everybody. That's amazing. We'll talk about primary, secondary, tertiary. Well, let me just bring it home now. What you want to do is get a solid understanding of primary, secondary, and tertiary. So, I'm going to call on people. Brumbaugh, not Brumbaugh. Did I call on Brumbaugh? Yeah, you're back now. Megan Brumbaugh. Primary. What primary? Hello, welcome. When you think of primary prevention, what comes to mind? No wrong answers isn't well, there are wrong answers.
Primary intervention would be like something you do directly.
Give me an example.
So if somebody comes in, you give them a vaccination for
Oh,
something.
that's it. That's all you need to do. Vaccines. I got me all excited early in the morning. Murray. Primary prevention. Give me something else you can do. No, I'm sorry. Alexis Murray. I'm looking at Murray.
You could
He's looking at me.
change your diet, eat healthier.
Yeah. So primary, you want to like go into all of your exams knowing what primary, well, a lot of things, but I really feel like if you get what primary, secondary, and tertiary prevention, what it is in your mind and an example, and if you should see it again, you would be solid. So primary prevention is, think of vaccinations. That should come to mind first. You're giving someone something that does not have that particular entity, disease, so that they can decrease or not get that. So you think of flu shots. Then you health promotion. You can think of health promotion. That's huge. So if you get those two in your mind, primary prevent, then health promotion is like, I'm telling you that you need to eat 5 vegetable fruits, that, don't smoke, don't drink, don't do this, do that, so that they don't do these things, and so therefore they never develop such and such and blah blah blah. So you want to live in a land of primary prevention and public health. That's what I did. I did a lot of fairs, a lot of flu shots. I did a lot of we had Rocky Mountain spotted fever, did a lot of stuff, but I did my assessment so I know what I needed to focus on. Because if you just go in and like, then what you it's just like you're gonna close your eyes trying to hit a target. But if you know what you're dealing with coming in, you can be more effective. And you want to be effective as nursing. When you go in and you assess that patient at bedside, when you guys do your med surg, you want to leave that patient better than how you found them. That's your number one goal. They was in pain at 10 when you came in, they should not be at 10 when you left. So don't let me digress. Secondary, S screening. Think of S screening, S survey, S surveillance. You're looking for something. For women, think of breast cancer screening, prostate cancer screening for this, screening for that, looking. Surveillance. Surveillance is when you're monitoring trends. Somebody had to do a surveillance and like, oh, we have this new disease called COVID. Oh my God, I have found something. You're detecting, you're looking. but there's no disease at that point. You're looking and you may find something, but your focus on secondary is looking, screening, monitoring. So it's not health education focus or vaccine focus. So if you were to see something like that, you'll think, I'm looking for something, I'm monitoring something. Primary is that as an action focused more so than I think, well, it's more prevention focused, prevention, P prevention, S screening survey. Tertiary is the only prevention where whoever and I talked to, Shirlea Lynch. Tell me a little bit about tertiary.
It deals with both the the clinical settings and stages of the actual disease.
I'll take it. Ashley Blair Cunningham. Unless
So
there's
that's
another
like,
Ashley Blair.
is that kind of like if you have already have the disease itself, we are trying to kind of manage what we already know about for example, like diabetes, if you're giving medications and stuff, you're just managing what is already there.
That's all day. Somebody did their readings. I don't even know if I can add to it. Tertiary, there is a disease present. There is a disease present. I'll have a student that don't let it trip you up. So you can educate somebody that's getting chemo that they're gonna probably vomit, but they have cancer. Because they're like, oh, well, it's education. You're gonna always educate someone to their grave. If somebody's on hospice, you're gonna educate them about the dying process, right? Not just gonna sit there and let them die. So there is a disease present. If there's a disease present, it's tertiary, period. If there's disease present, do not let that trip you up if you should see anything ever again. If it says diabetes, it's tertiary. They have it. You cannot look for it. You cannot vaccinate it away. You cannot do health promotion to prevent it because they have it. So keep that in mind. Okay. Evidence-based practice. When you think of evidence-based practice, who have I? Letitia? Is there Letitia here with us today? Let's see, Letitia. Evidence-based practice. Don't hurt yourself. What does that come when I say evidence-based practice? What do you think? Keep it simple. Don't complicate it.
That they've done research and they realize that there's evidence behind why they do this.
So research, Jocelyn, where are they getting the research from?
From the community.
When you think of evidence-based practice, where are you getting your research from, Alexandria? Wake up. I see like your eyes.
Collecting data and doing research.
I need to see all your beautiful face, Miss
Collecting data and doing research.
Oh, that was my good ear. Okay. Okay. Gore. Is Gore with us today? Gore is not with us. Oh, there you are.
TIA. What comes to mind when I think of research or no, where
evidence-based. Chapter 9, I think, talked about evidence-based practice.
you want me to say where they're getting
I
the
want
research?
you to say, when you think of evidence-based practice, what comes to Ms. Gore's head? Boom. You think about
Like using
There's a word, some words I need.
yeah, I'm trying to think of the word.
Anybody want to help her out? She's like, no, she's on her own.
Literature that supports day-to-day clinical issues.
Come again, Michaela?
Like literature behind day-to-day clinical issues.
Literature. I don't want wiki.
Scientific journals.
Yes, that's something that has been tried to rigorous. I love when my patients come into practice and like, this Harrison, oh, my cat is frisky. This Harrison-Hauer, I was on CDC. I just get chills. You bring me some wiki stuff, I'm just gonna give you that side eye, like, what you do, you want to make sure the evidence that you use, especially if you guys are saying somebody wants to go to be NPs and BSN, especially if you get your bachelor's, the more education you have, the more papers. This is nothing what they have you guys do. Papers and articles and stuff that have to be within 5 years. They have to be scientific journals, no CDC, Wiki. Because think about what you're using, what you're using to design your program, your intervention is going to be tried on some people, and you want to make sure that the stuff that you're getting is reputable. Okay, you want to make sure that what you're using to back what you're. If you're coming to me telling me like such and such and such and such, I'll listen to you. But if you're coming to me from some stuff that you got from Circle K, I am not going to take you serious, and you'll be laughed out of the nursing world. So that's what we do. Folks do research. They do analysis and all these things so that we can take this information, extrapolate it, and use it for the greater good. So that's what you want to think of when you think of evidence-based factors. Going into, let me make sure my time, going into a vulnerable population. So I think I have, we don't have Miss, she's not in class today. Letitia, is Letitia here? Letitia? No?
Yeah, I'm right here.
There you go. I see, oh, you're right next to me on this big old screen. Vulnerable population, what comes to mind?
Poverty.
Okay, definitely, okay. And then, so I'm looking at so I'm gonna go back up to Katie. Vulnerable population, what comes to mind? Homelessness. So when you think of as a community health nurse, vulnerable, give me, you know what, I'm gonna ask a couple more people. Megan, give me an example of a person or a group of people that would be considered vulnerable.
Which Megan?
Which Megan?
Oh Lord, I need to work on my Delay and Brumbaugh. Delay, go first.
Oh, a specific person or type of
institution.
person?
Yeah. Think of, if I say, who do you consider a vulnerable population? You should be like,
Poverty.
okay, fine, you already said that. Besides poverty and homelessness, give me somebody else.
Minority.
Thank you.
Immunocompromised.
Sure, Brumbaugh.
MRDD.
Ooh, I can't hear you. Say it again slowly.
MRDD.
MRD. What's MRDD?
Developmental delayed.
MRDD. Oh, okay. Gotcha. So a vulnerable population is a special concern. Well, there's a lot of things of special concern because they have whatever they have health conditions that put them at risk. It puts them at risk for developing chronic diseases, health problems, more so. So it's something, however it's defined, whoever is defined as vulnerable population. And I think of those folks like during COVID, they were like prioritizing who gets this, who gets that. So it's like, however we define them, MRDD, what have you, homelessness, and compared to those who are not vulnerable, they have a higher risk of health problems and complications and other factors that you want to give them special attention and treatment for. And so then they are exposed, so homeless folks, they're exposed to, lack of health care. They usually have a higher rate of like asthma and diabetes and what have you. There's a growing number of poor people in the United States. Decreased availability of housing has caused vulnerable populations to grow. Inadequate education, households headed by women, believe it or not, tends to put folks at a vulnerable population group. Children poverty rates are higher than adults, is what I was looking at in our readings. So that's something to keep in mind. Children who live in a single parent homes are more likely to be poor than those who live with both parents. That's your textbook, not Professor Harrison-Hauer. So then they have these complex, however the United States defines, this is not my definition, your your vulnerable population, they come with usually complex health issues that arise from being vulnerable, such as lack of sleep. I mean, think if you're homeless, think if you're, and I guess they think with single parenting is that, as far as making sure you have enough income in the house to eat properly, proper education, and also vulnerable population getting medication. Think if you're homeless. I always think homeless because that's like, I don't know, for some reason, I'm like, when I see them out there in the elements, I'm like, they're exposed to everything. So just for me, when I think of vulnerable, if I have something on an exam, I think of like the typical homeless person or the camps, and I'm like, okay, I look at the question again, I'm like, okay, I got this. Socioeconomic problems put people at risk. We talked about poor health outcomes, chronic stress. That's the thing. Folks don't realize the impact. And I'm not going to digress. Don't worry of what stress plays on your body day to day, not knowing if you're going to eat, you're going to sleep, somebody's going to come rob your cart or what have you, which is like everything in your entire house in your existence. I'm reaching over because I didn't bring my other table now. I'm perched. This is rainwater. You guys have never bought rainwater before. I know you're probably like, why is she buying rainwater? It's quite tasty. Okay, so I'm cracking Michaela up over there. Are you laughing, Michaela? I got you. I see everything. I have kids. I have 4 kids. I have adult kids in their 30s. All right. So then families. Families are the context in which healthcare decisions are made. Anytime you have, and then bring it back. I just want to give you everything, but I can't. So anytime you think of a family unit is not your traditional Leave It to Beaver. It can be. There's nothing wrong with that. It can be 2 moms, 2 dads, an auntie, it could be Dorothy and her little dog Toto. I don't know. But it's whatever they define that family is. And so if you're working with folks in a community, you want to make sure you involve the family if the patient's okay with it. And usually with family dynamics, there is some element of involvement with auntie, uncle, that sort of thing. So the family dynamics is the study of families structure. So you want to look at who's the genders, who's living there, income, marriage, divorce. Again, there's always some element to assessment, always, when you're dealing with whatever population. So if you're dealing with that family in that home, you want to know everything about them. And so nurses should always ask the clients whom they consider to be family. So again, don't assume it's that traditional, whatever you think traditional is in your mindset or in your culture. You always ask, is there anyone else that we should get involved? Like when I did hospice, again, what's her name over here? I'm looking for, well, she went somewhere. Have I done everything? Not quite everything, but I did a little bit of hospice. And you want to involve who that patient wants to involve in their end of life care. So when you're looking at family health risk, I just want to make sure that I cover my notes here. You're going to look at the same things as well when you do your assessment. What's potentially putting that family at risk? Is it the housing or lack of housing? How many the incomes? Do they have sufficient food and that sort of thing? You're always doing your assessment ongoing, and then we won't get into it. But from there, when you assess, like you do, I will kind of go back and just kind of tag you on your clinical. You're like, okay, you assess the patient and then you design in your mind, like what you're going to do for that shift. So for that time you spend with that patient, you're going to design your interventions and programs, but that is for another talk show. Chapter 22, we talked about health risk across the lifespan. And so good nutrition is essential for healthy growth and development. And that's probably why, well, sure, that's why they mentioned that children is one of the largest groups of poverty folks, and why we're concerned, because they're trying to grow bones and mentalities and ligaments and all this kind of stuff, and they need proper nutrition during different stages of their lives and what have you. So good nutrition is important. The adolescent population I have in my notes is at greatest risk for poor nutritional health. Why? Probably because they're out, they're more active, they're playing sports, sometimes they get that growth spurt. But either way, immunizations are important throughout the lifespan, not just for children, but they mentioned that immunizations are successful in the prevention of selected diseases. So you think of your flu shots. And then are there barriers to immunizing children, such as cost and convenience? You want to, if you ever work with a public health nurse like myself, well, I used to for 7 years I'm still on a reservation, but now I'm an NP. We were vaccinated during flu season. We went out to the villages, remote villages in the middle of places and knocking on doors. And so that's what we did. When you think of adolescents, children, accidents and injuries are the major cause of health problems in the child and adolescent. Accidents. Most of them are preventable. Are they? When I don't know, your street, I'm like, why does that child not have his bicycle helmet on? What's going on? Most of them preventable, seatbelts, all of that stuff. Children of homeless families are at risk for health problems, environmental dangers, and stress. Going into smoking is a risk factor for some health problems, including when they talk about if they're smoking in the home, like lung cancer, heart disease, osteoporosis, that sort of stuff. It talked about cardiovascular as being the #1 leading cause of death among U.S. adults. Back in the 1900s, people died of the Spanish flu, infectious stuff. Now it's chronic disease stuff. So, and then what else do I want to talk to you guys about? School health nursing. And then I have a video I want to share with you. School health nursing, I mean, there's a lot of types of nursing that have my heart, but definitely if you had children in school, you have your school health nurse, and she is just everything for those kids. I still remember a couple of my school nurses from back in the day. Starting in the early, well, officially, I guess, in the 1900s, when they were screening children for infectious diseases. Remember, beginning of the century, we had the 1900s, infectious diseases. Now it's going more complex, and these guys are considered a specialty of community health, public health nursing. And so they're dealing with folks that have trachs and vents and diabetes and asthma and the chronic diseases. They actually have their National Association of School Nursing, so it's a thing. They're all organized and stuff. There are healthy, which one? I'm looking for Megan DeLay. Remember, you were like, healthy people, healthy people, healthy people. There is a healthy people has objectives to enhance the health of children. I don't think there's a lot of healthy people objective or anything. When it comes to this class, whatever you're dealing with, that's what you should focus on. So specifically in chapter 31, they talked about healthy people 2030, and I think it's on your study guide. Hint. Healthy people has objectives to enhance the health of children in schools and increase the number of nurses working in the schools. I just gave you an objective. So here we go. Miss Lynch. Did I already call on you again? No, I did not. Let me just keep my thing. Miss Lynch, when you're thinking of primary prevention in schools, what comes to mind?
Can you repeat it? Because it's breaking up for me.
When you're thinking of primary prevention in the schools, what comes to mind? Give me an example of primary.
Like educating the kids.
About what? Give me something.
Let's see. School bullying.
Yeah. That's a lot of things. 11-year-olds hanging themselves. Don't get me started this morning. Probably too late. Udala, give me something.
About we can talk about the immunization of the children.
He understood the assignment. Okay, Miss Eden. Miss Eden, I've already called on you. Myers. Do we have a Myers?
Like hand washing or providing more nutritious lunches choices.
Mm-hmm. Deepa. Secondary. So let me just go back. Primary prevention includes health promotion and education to prevent childhood injuries, disease, and substance abuse. There's other stuff, but that's what the chapter kind of talks about. Miss Deepa Giri, is it Giri?
Yes.
Secondary prevention in schools. Give me something.
Would it be like a contraception education? Like
You're doing education again. What is, so you got to think secondary. What is secondary prevention?
Screening.
Oh, who helped her? Sarah?
I did, yeah.
You're so wonderful. I can just go in. Okay, well, Sarah, go ahead then, since you know everything.
Well,
give me something you would
screening
do.
in school children. I'm trying to think because that's
I'm a little bit older than you guys. Y'all didn't get screened for scoliosis when you had to do that dip? Was it just me? They don't do that anymore? Like when you
they did screening for lice.
And then they check your back? They don't do that anymore?
My daughter's school does eye and hearing, but they don't do scoliosis.
Okay. I'm in my 50s. So who had that done? Please don't let me be the only one.
I did.
Thank you, Megan and Ashley. When you kind of did that dip and then they ran down your spine with your like this and they checked to see in middle school?
They didn't do that to my kids though. They
I'm
stopped.
talking about to
doing it.
you.
To me, yes. But
Thank
like in
you.
the newer generation, no.
Okay, I was just thinking I was out there all by myself, somebody looking at my spine for no apparent reason. Miss Murray. Okay, so no, let me come back, Miss Murray. So secondary prevention involves screening. So remember, you want your screening. Just if I say do secondary screening for homeless people or something. I don't know. They can throw in anything. Secondary prevention, you want to think screen, like what am I screening for? But you know, as long as you know the word screening, you'll be okay on things that you see later in your life. So involves screening children for illnesses and providing direct nursing care. So school nurses can do plan for emergency care in the schools. They may they're mandated reported for suspected cases of child abuse or neglect. Again, the head lice is a big one. They also work with disaster plans and that sort of thing as well. I'm telling you, you'll see in a moment. And then tertiary, Nickerson.
That's going to be administering your medications.
For what?
It could be insulin. It could be
What will you give insulin for? Come on now.
diabetes.
Thank you. That's painful. McDowell, I don't see your face again. You think I don't see your McDowell? I need to see your beautiful face. I need to see all of you. All of you. McDowell. Alexandria. Alexandria? Let me center. Alexandria McDowell, are you present? You guys aren't in the room with her, right?
No, we're all at home.
Oh, you're at home today. That's awesome.
Some are at school, some are at home, but nobody's with her.
She just
That's
texted
fine.
me. She said her she can't see or hear anything on her Zoom.
Okay, yeah, because it looks frozen. Okay. Who was this that just said that?
Shalea. Leah.
Okay. Oh, it's not okay for her, but that's between her and administration. I just give them the data. That's all I do. Miss Del Cole, tertiary, we talked about. Okay, give me something else. Well, you know what? That pretty much summed it up, because tertiary includes caring for children with their long-term health care needs, asthma, diabetes. Folks have realized little kids can have issues too. And then we're not even going to get into like mental health. I can have you here all day, but we have things to do, right? So they're doing catheterizations of kids as well. They're doing suctioning, GI tubings, and it's tertiary. There's something she's caring for. Think of that as your direct patient care, what have you. And then so I want to show you guys this awesome video that I usually like to share that kind of hones in on school health, talks about school health nursing. Let me see if I can find it. Can you guys see my screen? Just Miss Lynch, can you see it? For some reason, that's the only face I see right now. I'm in score. Okay, awesome.
Is there sound?
You guys don't hear the sound?
No.
You don't hear the sound, but you see the video.
Yeah, we can see, not hear.
Oh, I wonder if it's because it's in, hang on. Let me get out of my earbuds. Because I'm hearing it. That may be why. Let me. Budala, I see your face. Can you hear it now?
Yes.
Okay, so it's me. Let me go back.
Oh,
We can't hear again.
now I can't hear it.
You can't?
No.
No one can hear it, correct?
No.
Correct.
Let me. Let me look at a couple.
We can't hear you now.
You're still mute, Professor. Still mute. Still mute. No, can't hear you. I can read your lips though.
Okay,
We can hear you now.
okay. I had my buds. I took the buds out. I'm trying to see if I want you guys to really see this, but I may have to get over it. So I can hear the video. Can anyone else hear it? Letitia, can you hear it? Lynch?
No.
No?
I
No.
could for just a second in the background, but it's gone again.
You guys still unable to hear it?
In this very specialized practice.
We can hear something.
You
Yeah,
can hear it?
I heard it for a second and now it stopped.
So Sarah, I'm gonna use you. I can see your face is right underneath my picture. So I'm gonna talk to you. We'll talk.
Okay.
You hear or don't hear?
I cannot hear anymore, no. I heard a little bit, but now I can't hear anything. It like comes and goes. It's weird.
Let me go to another part of the. You hear now?
No.
No.
Well, we'll come back to that later. I moved to another part of the house, but nobody can hear it, so it is all good. Let me stop sharing. Hang on 1 second. All right, because time is moving away from us, so we need to okay, let's get into our case studies because time is tick-tocking away. It is what it is. School nurses rock. All right, so I'm going to put you guys into your breakout groups. I'm also going to share you with the case study with your groups. You'll be in there for a good few minutes here. Then we need to try to wrap up. But I want to get through the most of it if we can, because it's a really great case study. So let me put you into breakout groups and then I'll share. Let me see. I'm going to share. What you guys will be working on. And everyone has to participate. You'll start off with the scenario that you guys should have received. So you should have, read it by now and been familiar with this. So let's see. You guys will be in there probably for a good 20 minutes and then we'll come back and wrap it up. Let's see, I will assign, let's see, we have,
Are we gonna take a break at all? I have to use the
We
restroom.
usually, if you need to use the restroom, just type in, we usually go straight through, well, we leave a few minutes early. Just type in that you're going to the bathroom and just type in, to me, not to the whole world, that you're at the bathroom, and then when you come back, that's fine.
Okay.
All right, you guys. Hold on a second. You guys work through this together, not one person. And 1, 2, 3, and then. All righty, see you guys in a few. I'll be checking on you. Sorry, let me wait for everyone to come back in. No one's able to see it in the breakout rooms, which is maybe a button I need to click, but I'm waiting for everyone else to come back in, and then we're just gonna go through it together. That is perfectly fine. You should have been able to, it's not sharing in the breakout room. So I need to look at my settings on Zoom later. So you guys, we're gonna go through this case study together. And now what I'm gonna do is I'm gonna round robin, all righty? So let's see. All right, everyone's back with me. Okay, good, 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 all right. So Miss Myers, Does everyone, do you guys have your case study that I shared? But let me share it again. All right, everyone's able to see this, correct? All right. So we're going to go through this together. You are a nurse at our local hospital in an urban area. In the past month, you have discharged the following 10 clients between the ages of 23 and 35 who were hospitalized with short-term complications of uncontrolled type 2 diabetes. 3 Latino males, 2 African-American females, 1 American Indian female, 2 Filipino males, 1 Caucasian male, 1 Caucasian female. So I'm going to go down the list here. Number 1, let's start with Tika. You read it and give me your answer and why.
We couldn't like really look at it because we didn't get to go into the document, so we were having problem.
Okay, well you can read it now, right?
Yeah.
Okay, go ahead, read it. Give me. There's some answers. We're gonna go through it together.
I can't still find the thing. I just found like.
No, can you see it on the screen?
Yeah.
Okay, well read it and give me your answer.
Answer for
number 1.
Which 3 of this respect for? Family history. And I pick A, E, and D.
Your answer is A, E, and who?
D.
A, E, and D. There's 3 answers, and one of them is correct, and that is E. So which 3 risk factors for uncontrolled type 2 diabetes was mellitus are most important? So anytime you see that in a test where most is highlighted or bolded or something, all of those could possibly be potential answers. And then they're telling you that you're going to select 3. So for uncontrolled type 2 diabetes, it's not family history. It's not what you want. You want B, high blood pressure. You want E, sedentary lifestyle. And then you want F, obesity. Family history is usually more concerned with type 1 diabetes over type 2 diabetes. And then when you're looking at the fact that high blood pressure tends to, for some reason, it tends to go with type 2 diabetes. That's just how it is, I suppose. But you want to know, the correct answers are B, high blood pressure, E, sedentary lifestyle, and obesity for type 2 diabetes. And then for number 2, let's give this one to Blair Cunningham. Read it, and what would your answer be?
It says, what would you need to know about this population with uncontrolled type 2 diabetes to help them plan for their care after discharge? I would definitely say A, just because you need to kind of know their educational level to know how to speak to them, and so that they understand when you're given the discharge instructions. So
Yes,
when they
ma'am.
are out on their own. I would say the current, I don't know about current living arrangements. I would say definitely D, their occupation. Just because we need to know what they do for a living, if it's something that they can really look at, if they can check their sugars, you know, and it might help even with maybe like their wages.
Preach,
and if
Ashley,
they can afford.
preach. Yes, yes. Go ahead, girl. These are the kind of answers I want. See how she's confident in her stuff? First of all, let me back you up. I hate to stop you, but go with your gut. Go with your, can you hear me?
Yes, I can hear you.
Okay, go with your gut. You're like, I don't know about current living. Always go with that first gut. I'm telling you, that's how people change and unchanged answers. But yes, current living conditions, and you got the education level, current living conditions. I'm looking for one more. Occupation, I'm looking for one more. Did you say preferred language?
That was going to be my next one, just because we need to know how to speak to them, because if it's somebody who speaks Spanish and we're speaking English, they're not going to understand our discharge instructions.
Yes, 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 yes. Number 3 goes to Budala.
In addition to medication and follow-up appointment, which of the following would be the most important to address the discharge plan? I will put blood glucose monitoring.
Why? I'm a why person. It's correct, but why?
Because we have to know how high and how.
That's how you gauge daily how they're doing with their blood sugars. Yeah, how they're doing with managing their disease. If you were going to say foot care, I was going to pass out in this chair. So thank you for not letting me pass out in this chair. So I do appreciate that. Number 4, Delco, Jocelyn.
Who is the best person to contact to find out about the hospital's involvement in the community care for people with diabetes? I would say D.
Why? Remember, I'm a why person. Why?
Because social work has a lot of contacts in order to prepare patients that are leaving the hospital.
And the contacts in the community, because that's where you're getting ready to send them back out to. That's excellent. Deepa, take number 5.
Where would be the best place to get valid and reliable data to determine if diabetes has increased in the community over the past 5 years? I would say local health department, because I feel like that's where all the data goes to, like when they do surveys and like the census, that's where it goes to. And since
remember, I was asking that original question in the beginning of about an hour ago. Yes.
Oh, the surveys and that, yeah.
I'm like, where are you gonna get your information from? Very good. Megan, number 1 or 2, let's do Brumbach for the next one.
Which question?
This will be, are we on 6?
Yeah, number 6.
I need you to read it.
Which data would be most
yourself
important
too,
to
but-
determine if diabetes is an increasing health problem in your community? Incident rates for the community?
Okay, what kind of, diabetes incidence rate?
Yeah, A.
Yeah. Why A though? And you know, I'm a why person. I gotta know why. I gotta know what you're thinking.
Well, if you're looking at the most important thing to show if it's an increasing problem, you're gonna look at how many cases you have.
Yeah, but I'm looking for something specific you haven't given me yet. What type of cases?
Diabetes incident rates.
No. What is the difference between incidence and prevalence? Why? Okay, I'm looking for a certain word. I'm not picking on you, but there's a lot of cases. I don't want to know. There's a word I'm trying to pull out of you. They're new cases. Incidence rate is new cases.
Right, prevalence is how many total.
Yes. So if you know, if they said it's an increasing problem, then I want to know how many new cases. So the Native Americans I work for, they have the highest incidence and prevalence of type 2 diabetes among any type of ethnicity group, the people in the rainforest, the folks in New Zealand, the folks in the Arctic pole, in the entire globe, the whole Marvel galaxy. That's what fascinated about me. I did my first paper when I was in MPH school in 2004 with the Pima Indians, and that's who I ended up working for. New cases and existing cases. Talk about a challenge when I became a public health nurse, but I think we did some good. All right, Megan, number 2. Which Megan, yeah. Take number 7.
Okay, bear with me because I can barely see it.
Is it? I got it on the big old screen.
Oh, I'm on my phone because I couldn't get my laptop to connect to Zoom. So it's like this big to me. And I'm like,
so you want to, you just kind of, you got it. We'll wait for you.
Okay. To be able to better understand factors influencing the occurrence of diabetes mellitus type 2 in your area, which of the following data would be most helpful? I can't read these.
Do your best, honey.
I'm trying. So tiny.
Can you expand that thing?
I keep trying, but like expands and then goes back to normal.
I'm in a giving mood today, so I'm going to help you out. I'm going to read it to you.
Oh, thank you.
To be able to better understand factors influencing the occurrence of type 2 diabetes or diabetes mellitus type 2 in your area, which of the following data would be most helpful? A, state level diabetes prevalence rates by age, education level, and socioeconomic status. Local community diabetes incidence rates by race, ethnicity, gender, and socioeconomic status. National data on diabetes incidence rates by gender, race, age, blah, blah, blah. Community hospital discharge registry data. So there's keywords that even if you can't read it, you should be able to, well,
because it says your area, so I would go with local community diabetes.
See, as long as you can read the word local, you could be like done with your life right now, but it's okay.
Yeah. Yeah,
okay.
Because that's where I was going with that.
All right, okay. Bless your heart. All right, so then have I spoken with Katie?
You want me to do number 8?
Please.
Okay, which risk factor for poorly controlled diabetes is better addressed at the community level than at the individual level? I would say see lack of community knowledge of health diets, just because as a community, certain communities, they have more fast food restaurants and they do healthy eating places. So that is an increased risk of diabetes for being obese.
That is so beautiful, but it's so incorrect.
Oh,
I love it though.
Sorry.
You're on a roll. You're on a roll. It was so lovely and poetic. All the adverbs and adjectives lined up. There was, commas and different things. But if you understood the difference between primary, secondary, and tertiary, you would not have answered that. But it's okay. That's what I'm here for. So community knowledge of health diets would be good if they did not have diabetes. Anybody else want to help her out?
I would say a lack of recreational space.
Oh, yes. Why?
Just because living a sedentary lifestyle, you're at higher risk for diabetes.
Well, and you already have the diabetes, so exercise is going to help you control it better.
A is primary, C is tertiary.
Other way around. A is tertiary, C is
there you go, Letitia. Let me just give you my badge. So no. All of those are great, but you have to know what you're focusing on. You got people that have poorly, remember, you guys have to always, I just wish I can just give you my brain, but whenever you have a scenario and a series of answers, it would behoove you to go back and look at it, because this whole doggone scenario is about them people in that hospital that's getting ready to be set out into the world with this uncontrolled diabetes. And she's trying to, this discharge nurse needs some help. So she's like, what am I do? What am I do? So what risk factor for poorly controlled, which means that A1Cs are horrible, the blood sugars are horrible, poorly controlled. I had a girl the other day in her 20s that was hospitalized. She came to see me yesterday with diabetic ketoacidosis, you know, in the ICU for diabetes at 25. What risk factor for poorly controlled diabetes is better addressed? Remember the community. So, you know, it's not just, it's that community that you're looking at the top, but other folks can benefit from. So remember, you're looking at what's the greatest good for the most people. And sometimes it's so simple, you're like, it can't be this. But just a place for folks to exercise and work out. Because remember, I mean, I know you guys are learning, but your gestational diabetes should have, like, whenever you're looking at a question, and if you have 4 answers, if you can't knock out 2 right away, you didn't study. I'm just going to be so real with you guys. If you can't knock out, if you have 3 and you can't knock out 1 right away, you just didn't study. So gestational diabetes has nothing to do with nothing. Okay. Generational family history. I would have just been like, don't play with me, don't play with me. And then you look at lack of, okay, lack of recreational space, lack of community knowledge. And there again, community knowledge of health diets is good at the primary level for somebody who ain't got no diabetes. So then if you look at community knowledge of health diets, that should have been like, okay, that's good to do, but you got poorly controlled diabetes. So then you're like, you know, yeah, what can I do for this community of folks? And that benefit everybody else too. So that's something to where when you look at it, you're like, okay, knowledge of health diets is primary. Professor Harrison-Hauer says primary is when they don't have something. So if they said that, what would be a good community level intervention to help people not get diabetes or something, not get to live healthier lives? I don't know. The word diabetes should trip you up. Okay, I'm beating this horse down. So got the answer. Moving on. All right, so let me have, I don't know if I talked to Ms. Gore. Ms. Gore, give me number 8. Oh, did we do 8? Give me number 9.
Which is the most significant evidence you could present to the Board of Health to help with their deliberations?
Take your time. You're in a group, you're with a group of important people. Well, oh, what is that? Someone should mute their children, not the children, but mute yourself. Okay, I'll be back in just a minute for you. All right, let's go. What you thinking?
The evidence.
Yes. So you're the most, that's that capital word again. You're trying to show them the importance of what's going on. And so you're a nurse. I'll walk you through this. It's fine. Well, you know what? Give me an answer. I want you to try. Remember where you are in the beginning of the scenario.
Prevalence is total, you said, right?
Yes. But remember where you're located to begin with. Where are you in the scenario? Where are you? Where are you?
Presenting to the Board of Health.
No. Yes, you are, but where were you in the beginning of this scenario? And whenever you get stumped, go back to your scenario when they do case studies. Where is this person located? I mean, where does she work? She's in the,
I don't remember.
anybody want to help the sister out?
She's
Just
in
getting
the
too late for this.
hospital.
Huh?
She's
She's
in the
in the
hospital.
community.
She's in the hospital. First of all.
Okay.
I remember she's got this group of people and she's going through all of this stuff because she's getting ready to send them out. So anytime you get stumped, go back to read your scenario again. And then like, what do they want out of my life? What is the most significant evidence you could present to the Board of Health? Because she's doing the most. She's got so many hats. She's doing this. She's trying to do a walking path. She's trying to present to the board, but she's trying to do all these things before she sends people out. So she's going to let hospital data on diabetes prevalence in clients from the zip code. And I know you're like clients from zip code, but the whole point is that she don't want county and state. That should be like, we're not talking about the county and state. So just don't let the rest of that bother you. They could say the county and state of diabetes prevalence in the Marvel Galaxy. No one cares. So we're not dealing with the county and state. They can say client stories about managing diabetes in this community. Just know. I don't know. Well, just know. I don't know what else to say. Just know. What's the most? I mean, stories are great, but stories are just like, Lifetime channel. We don't want to hear that stuff. We want meat and taters. We want some data. You want to move some people on this board to give you money for a walking path and all this other stuff. An explanation of the consequence of uncontrolled diabetes. That's lovely, but go back to whenever you get stumped, go back to your scenario and then look at it again. If you can't eliminate 2 out of a 4 thing, definitely you can't eliminate 1, then, God be with you. I don't know. All right, so then 10, we're doing good there. Let's give me Alexandria. Is Alexandria with us? Yeah. I keep checking.
I'm here.
Okay, Miss McDowell. Number 10 is yours.
I'm about to guess because I don't know. A.
I need you to read it.
You want me to read the question?
Please.
Which of the following individuals needs to be involved in planning the walking path? Select all that apply.
It's a loaded question, but take your time with it. You don't want to, guess, but just you want to know why you're guessing. You just don't want to be like, I'm hurry up to get this class over A, B, C, D, E, F, G. Because this is your education's. Go.
The school district superintendent, the public health nurse, the local residents, and the high school principal.
Girl, you got all that right. Why are you playing with me today?
I'm not playing. I didn't know. I just guessed.
No, it was a good guess, but it had to be something in here to make you guess the correct ones. Because the thing is that if you're trying to plan anything in somebody's community, you want to okay, so A, the school district a superintendent, you're probably like, why him? Because he's got more reach in the schools, okay? He's got more reach. So apparently you want, you want as much support from as many people that have influence. And then you definitely want the public health nurse. If y'all would have got that wrong, I don't know what to say. And then you definitely want the local residents before you put something in their backyard. And you want the high school principal. And you're probably like, well, why the high school principal? Because again, the high school principal is this walking path is, again, it's local at the high school, you're going to involve that person. You don't want the PE teacher, because bless her heart, she's wonderful, but she don't have that much. She's just one person. She has other bosses. She's got a superintendent, she's got a principal, blah, blah, blah. Number 11, I may not get to everybody, but let me see. Come on now, give me, have I spoken with Sarah lately? I don't know. Sarah, talk.
No, I can go. What is the most important action the RN can take in the hospital to use this information to help clients? I'm gonna say Would it be D, include it in the discharge planning, the physical activity resources? Or
And
C?
that, which one is it?
I feel like it's D because it says in the question, it's talking about all the clients but I think it's more when you give them that information, they have it in front of them. If there's like a poster on the wall, they may see it, but they may not pay attention to it.
So what's your answer, dear?
D?
Final answer?
Yeah.
You sound so scared. Always, 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 you guys, go with your gut. And again, if I can just send you home with one piece of advice, always go back to that scenario. If you get stumped, like, what does this question want from me? Go back and look at your scenario. Because remember, it started with what? It started with the fact that she's doing discharge planning. So what I love about this case study is that it just brings it into a full circle. Your answer is you picked correctly, but I wanted to hear your justification could have been the fact that, again, she started out with discharge planning. So now she's going to revise her discharge planning to include this, because of what she found in the beginning of the case study. But that's, again,
that makes sense looking at the beginning, but I wasn't seeing it, so I didn't even think about it.
I've done this 1,000 times, but to me, it's like, if I can, I don't know, when I look at things, when I tackle things, I'm sure I aggravated my parents because I'm a why person. If I can get the why, then you can't trip me up. Does that make sense? So like what I've learned, and I'm trying to implore it with you guys, is that whenever you're on a roll, let's just say a case study or whatever or anything has like this scenario and it gives you these answers. And you're like, series of questions. Everything builds upon that. So you can always go back to the original question, even if it's just to take a pause and like, okay, I don't get what they want. Let me go back to the scenario. And then you read the scenario, because this whole case study is just a flow. This is this nurse who's realizing this group of people, and that's going to be her defined population. She's defined it because they have what in common? Uncontrolled diabetes. So she's defined her population and she's getting ready to send them out. And before she sends them out, she's trying to do all these things so that when they leave the hospital and go out into their community, that they have that she never, and when I tell my patients, and when I used to work hospital, I don't want to see you again unless I see you like at Walmart buying healthy food or at Kroger's or something like that. So they don't come back to the hospital with their uncontrolled diabetes, losing kidneys and toes and stuff. You guys have been amazing. Thank you for spending your Friday morning, an hour and a few minutes with me. I'll stay on if there's any questions. Let me stop the screen share. I send you guys, when I get the information, I'll send it to you. I am actually teaching another class for a professor today. So let me stop recording.